Good afternoon and welcome to the daily COVID-19 briefing here in St. Clair County. I'm joined with EMA Director Herb Simmons, and we'll get right into the numbers today. For St. Clair County, they've tested 290,446. That's an increase of 1,267 since yesterday. Positive test results received are 28,267. That's an increase of 53 since yesterday, and those are males and females under the age of 1 up to their 80s. Our daily county positivity is 4.2%. For negative results, they're at 262,179. Unfortunately, we are announcing 3 new additional COVID-19 related deaths today. That is a male in his 40s, a male in his 50s, and a female in her 70s, all with unknown health conditions, bringing the county death total from COVID-19 to 456. And as always, our sympathies go out to the family and friends of those who've lost their life to this virus. For those that have completed the IDPH required 10-day isolation period, we're at 27,251. For state totals, we're at 18,492,848. Positive tests are 1,194,702, which is an increase of 1,442 since yesterday. For deaths, we're at 20,700, which is an increase of 33 since yesterday. Hospitalization numbers for those hospitalized in St. Clair County hospitals due to COVID-related illness, we have 39 patients, and one of those patients is on a ventilator. Regionally, there are 76 patients admitted due to COVID-related illness, and 2 of those patients are on ventilators. We have no changes to any of our congregate living facilities today, so there'll be no updates to that. And as a reminder, we talk about this every day, but testing is still so vitally important, as it shows with 53 new cases today, unfortunately 3 deaths. COVID is still prevalent in our community, and we've got to do everything we can to make sure we slow the spread of this virus. So 7 days a week, St. Clair Square is testing, 8 a.m. to 4 p.m. Local CVS, Walgreens, MedExpress pharmacies, all offering tests. If you need a test, many testing sites are still available. I'll now turn over to Director Simmons for his update.
Thanks, Brian, and you're right. Testing is just as important now as it has been for the last 357 days. As you said, the deaths and the alarming part there is 40 and 50-year-olds succumbing to this virus. We can't let our guard down on that.
No, we definitely can't.
So we'll go right into the zip code report and see where they fall today. 62204 goes up 1 to 385. 62205 goes up 2 to 627. 62206 goes up 1 to 1,266. 62208 goes up 1 to 1,581. 62220 goes up 2 to 2,010. 62221 goes up 3 to 2,717. 62223 goes up 3 to 1,706. 62226 goes up 3 to 3,123. 62232 goes up 1 to 882. 62239 goes up 2 to 454. 62243 goes up 4 to 757. 62254 goes up 1 to 789. 62258 goes up 1 to 1,022. 62260 goes up 2 to 775. 62269 goes up 3 to 3,183. And 62282 goes up 1 to 64. As Brian said, our daily county positivity rate 4.2%, which is down from the 5.5% as of yesterday. Our regional positivity is at 3.9% today. The county 7-day rolling average 6.6. The other counties checked in today. Bond County at a negative 0.4%. Good job, Bond County. Clinton County 1.2%. Madison 2.5%. Monroe County 4.8%. Randolph 2.2%. St. Clair County, 1.6%, and Washington, 0%. So all those numbers are looking good there. Brian, a lot of work taking place at the mass vaccine site today. We were down there this morning. New tent putting up for lane 2.
Yep, they're finalizing everything for that second lane. Part of the staff is already there getting trained with additional staff arriving. More vaccine hopefully scheduled to arrive. And then with that being said, we look for that site to ramp up to several thousand vaccines per day.
Well, and the call center has been busy all day today, helping field those calls and helping people who's having problems, and that's what it was established for, to help those who may not be computer savvy, or some miscommunications as far as when they can get their appointments and when they can't. So, as we said, I did an interview earlier with the media that they wanted to know if anything else we wanted to get out there, and I said, yeah, patience is what we all need.
Absolutely, and the new Johnson & Johnson vaccine arrived. You spoke about that earlier today, and we actually do have some clinics starting the beginning of next week, where 2 days next week will be Johnson & Johnson days. So people that take advantage of those clinics, it's a one shot, and they don't have to come back for a second appointment.
Well, and that's what we talked about it to the media today. For 357 days, we've been all battling this invisible enemy, and the light at the end of the tunnel, we've been talking about it for 357 days, is getting brighter. With the more vaccine coming to the county, hopefully in the near weeks, we will be able to turn out more. That's why we are enlarging the center there with another tunnel to where we can double the output. So as Brian said, some of the staffing, extra staffing is in there being trained now, and hopefully by Thursday of next week, I think is our projection date. As long as the vaccine continues to come, we'll be able to meet that output need and get this thing put behind us that much quicker. We say it every day, you start by showing your interest in getting the vaccine by doing so, signing up on the EMA page. There's a form on there, simple form to fill out, or on the health department's page or on the county website. We've had 104,389 citizens have shown interest, and that's 1,060 since yesterday. So the demand continues to show as far as registering. And
Absolutely, and those that, once you get that link, if you don't get your appointment, keep checking back, because as more vaccine arrives, additional appointments open up. As I mentioned, we opened a couple single-dose Johnson & Johnson clinics. They're open on the portal now. People have been signing up for those today. So once you get that link, if it's full when you go back, revisit it, and more appointments are frequently added as more vaccine arrives.
Well, and the one thing we just want to stress is that the people in the call centers that are trying to help out don't control the vaccine. We don't control the vaccine. The health department doesn't control it. We're waiting for the notification of when it's going to be sent, and sometimes it's we get it within 24-hour notice, and so that's why you may say, hey, it's available tomorrow or Sunday, or so we don't control that part of it. So if you're in the need of your vaccine, as Brian said, just keep checking back, and when it's opened up, get you a date.
Yeah, and second, we had a lot of questions here recently about second doses. There was quite a few people notified last night for Pfizer second doses that opened up for this weekend. So make sure you're checking that. They should have got a text message or an email last night, and get signed up for those clinics. Get that second dose.
Very good. So that's the report for the day. We'll be back with Cindy in a few moments to translate this into our Spanish community, and then we'll be back tomorrow, Saturday, for day 358. Everybody have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.